Welcome to the deep dive. Today we're tackling a listener request, taking a closer look at adenocarcinoma renal A in dogs.
Ah, okay. Kidney cancer.
Yep. We've got some info covering, the basics, the signs, how it's diagnosed, treatments, and, well, the outlook. Basically, a specific type of kidney cancer.
And the sources mention two main types.
Exactly. Adenocarcinoma, which is apparently more common, relatively speaking. And then renal cystadenocarcinoma. That one's rarer and seems to pop up specifically in German Shepherds.
Okay, that's an interesting split right off the bat. The cystadenocarcinoma, the one in German Shepherds, you said it's heritable.
That's what the info says, yeah.
Yeah.
Heritable and generally less aggressive than the adenocarcinoma we're mainly focusing on. That seems like a pretty key difference.
Definitely. Origin and how it behaves.
Right. And just to frame it, this adenocarcinoma, the main one, it's actually really quite rare. Makes up less than 1% of all reported dog cancers.
Wow, less than 1%. So
Yeah.
not common at all.
Not at all. But what makes these kidney tumors tricky, apparently, is that they tend to spread. They're often highly metastatic.
Meaning they travel through the blood.
Yeah, and they can be locally invasive, sort of grow into the surrounding tissues, and sometimes affect both kidneys.
So rare, but potentially quite serious when they do occur because of that spread. That's a tough combination.
It really is. So focusing on the adenocarcinoma, who typically gets it, the sources point to older dogs, usually around, say, 8 or 9 years old.
Okay, senior dogs. Any breed predisposition.
Not really for adenocarcinoma itself, it seems.
Yeah.
Unlike that German Shepherd link for the other type, there is maybe a slight tendency towards males, like a 1.6 to 1 ratio, but not a huge difference.
Got it. And what about signs? You mentioned they could be tricky.
Yeah, very subtle sometimes, especially early on. That's the problem, right? Delays diagnosis. We're talking things like gradual weight loss. Maybe they're off their food, less energy.
It's sort of slowing down.
Exactly. You might spot blood in the urine. That's hematuria. Or maybe pale gums, suggesting anemia.
Okay. And there was something unusual mentioned. Polycythemia.
Oh, yeah, paraneoplastic polycythemia. Basically, a higher red blood cell count than normal. Like a side effect the cancer can sometimes cause.
Huh. How does that happen?
Well, the thinking is the tumor itself might release stuff that tells the bone marrow to make more red blood cells. It's one of those weird indirect effects cancer can have.
Fascinating. And because those main signs are so vague, like just getting old?
It makes diagnosis a real puzzle.
Yeah.
And what causes it in the first place? The sources just say, unknown for adenocarcinoma.
Right. A common frustration. So when a vet sees these vague signs, they have to rule out a lot of things. Yeah.
Definitely. Other cancers, maybe ones that started elsewhere and spread to the kidney, or even non-cancer things like kidney infections or cysts. Lots to consider.
So how do they start narrowing it down? Diagnostics.
Blood work and urine tests are usually the first step. They can give clues, like you might see those weird red or white cell counts we mentioned, anemia, maybe high kidney values showing the kidneys aren't working right, or protein or bacteria in the urine.
Okay, so those are indicators, but you need to actually see the kidney, right? Imaging.
Absolutely. Imaging is crucial. Chest x-rays are important to check if it's spread to the lungs. Abdominal x-rays might show a mass.
They probably need more detail.
Yeah, things like ultrasounds, CT scans, maybe contrast radiography. They give a much clearer picture of the tumor itself, how big it is if it's invading nearby stuff. Really helps if they're thinking about surgery.
Makes sense. You need to know what you're dealing with.
And for the definitive answer, the gold standard is getting a piece of the tissue, so a renal biopsy. That can be guided by ultrasound or done during exploratory surgery.
Biopsy is key. What about just sticking a needle in? Fine needle aspirate.
The sources mention that too. It can be supportive, give some information, but the biopsy is really needed for a conclusive diagnosis.
Okay, so let's say it is adenocarcinoma and it's just in one kidney. What's the treatment plan look like?
The main approach described is pretty aggressive surgery, removing the affected kidney.
Nephrectomy.
Right. But interestingly, the info we have doesn't really point to much success with chemotherapy for either type of these kidney cancers.
Why is that? Is chemo generally less effective for kidney tumors?
That's a good question. It could be several things. Kidney tumors sometimes develop resistance to the drugs. Also, since the kidneys filter waste, if they're already damaged, handling chemo can be tricky. and the specific cells might just not respond well.
Right. And if the dog's already in kidney failure from the tumor?
Then supportive care becomes really important. Fluids, maybe meds to help manage the kidney failure. And even if surgery isn't an option, monitoring is key, checking kidney function with blood tests, urine tests, and just keeping an eye on their quality of life.
And the prognosis for adenocarcinoma, what did the sources say about survival?
There was one study mentioned with a median survival time of about 16 months post-surgery.
Okay, a median, but that means half live longer, half live shorter.
Exactly. And the range was huge in that study, from basically zero to like weeks up to almost 60 months. Over 5 years in some cases.
Wow, that's a massive variation. What makes the difference?
Probably depends on, how early it was caught, the specific grade or aggressiveness of that particular tumor, whether it had already spread at diagnosis, and just the dog's overall health. Lots of factors.
Right. Okay, so that covers the main points for adenocarcinoma. What about the other one, the renal cystadenocarcinoma?
Yeah, the rarer one. Key thing.
Yeah.
Primarily German shepherds, often females, apparently.
And it has that weird associated sign.
Yes, nodular dermatofibrosis, these like painless, firm lumps under the skin. If you see those on a German shepherd, you might ring alarm bells for this kidney issue.
And critically, it's genetic in shepherds.
Definitely. Clearly stated as heritable. And interestingly, the prognosis seems generally better, or at least less aggressive. The median survival was reported as 12 months or more, even without specific cancer treatment.
Suggesting it grows more slowly, maybe spreads less readily than adenocarcinoma.
Things that way. So, quick recap then. Adenocarcinoma. Rare, but can be aggressive. Older dogs, signs are often vague. Cystadenocarcinoma. Even rarer overall, but linked to German shepherds, it's heritable, often comes with skin nodules, and seems less aggressive.
And diagnosis is a challenge for both, really needing good imaging and then that crucial biopsy.
Right. And treatment-wise, surgery is the go-to for adenocarcinoma if possible, but chemo seems limited for both types based on this info.
Okay, that covers it pretty well.
So thinking about how subtle those early signs can be, especially in older dogs, it leads to our final thought for you, the listener. What sort of proactive health discussions could you have with your vet about your aging dog, maybe specifically concerning kidney health, even before there are obvious problems? Something to consider.